My name is Charlotta Cooks, and I am going to be giving a presentation on the benefits of electronic medical records, also known as electronic health records. What is an electronic health record or electronic medical record? Essentially, these two terms are used interchangeably within the medical field, but each of them have their own definitions. An EHR, electronic health record, is a digital version of a patient's paper chart. EHRs are real-time patient-centered records that make information available instantly and securely to authorized users, like nurses, physicians, physical therapists, respiratory therapists. An EMR is a digital version of the paper charts in the clinician's office. An EMR contains the medical and treatment history of the patients in one practice. EMRs have advantages over paper records. Essentially, patients refer to their health records when they want to access them themselves so that they can look into their health history and keep accurate record of everything that's going on with them. The history of EHRs. Before EHRs, physicians kept brief written case reports about their patients, and they used these case reports to help educate and teach future physicians. It was first introduced in the 1960s, and there were multiple innovators. One such innovator was Larry Reed, MD. He introduced the POMR, which stands for Problem-Oriented Medical Record. This allowed for physicians to accurately gather important, pertinent information regarding their patients and be able to use that in order to help diagnose them and other patients exhibiting the same signs and symptoms of different issues that were going on with them. In 1971, Lockheed further innovated EHRs by incorporating CPOE, computerized physician order entry. The Veterans Administration was the first hospital or first facility to fully implement EHRs in the 1970s. There are some barriers and challenges to using an EHR, of course. Physicians tend to find it frustrating, but they don't want to return to paper charting at the same time. They find it frustrating because it can be time consuming. It decreases healthcare provider-patient interaction. Also, with using electronic health records, it makes patient information more susceptible to security breaches. There's hackers out there, and sometimes it can be easy for these hackers to get and access patients' information so that they can use them for criminal activity and whatnot. It can be difficult for older HCPs to use and navigate EHRs. They have to be taught maybe a little bit longer than anyone else. HCPs also tend to lose critical thinking skills, and it limits clinical documentation. It also is high cost when it comes to implementing the EHRs. Why should you use EMRs or EHRs? Even though it does cost a lot of money to implement these, it also saves a lot of money overall. It saves time when it comes to documenting and charting about different patients. It increases patient safety because it can decrease possible medication errors. It also makes it easier to catch and identify drug-to-drug interactions. It's easy to retrieve records. Say that a patient goes to a different facility, a different doctor, and they have to access their information. It's easier for them to access their information electronically as opposed to via paper charts. It also improves the communication between healthcare providers. There's a lot of patients out there that have 2 to 3 different healthcare providers, and it's easier for them to all be able to collaborate and corroborate using electronic charting as opposed to paper charting. It's also easier for patients to be more involved in their care. With electronic charting, electronic medical records, they are able to access their records themselves as opposed to having to go to a physician's office and them having to go to medical records and look for their paper charts. They can just access it from their home computer. There are different laws in regards to using electronic health records. Of course, when we're talking about anything medical, we have to think about HIPAA. This is a law that's put in place to help keep patients' information secure and private. There's also the Health Information Technology for Economic and Clinical Health Law Act of 2009. This act just helped to spread the news or the information regarding electronic health records around to different healthcare facilities. There's also the American Recovery and Reinvestment Act of 2009. This is an act that gave healthcare providers incentives to use electronic health records. This was an act trying to get more healthcare providers, more hospitals out there involved and educated about how important and the benefits of using electronic health records. Where can EMRs be used? EMRs can be used essentially anywhere when it comes to medical. It can be used in hospitals and long-term care facilities, SNFs or skilled nursing facilities. It can be used during home health care. It can be used in assisted livings. It can also be used at home. Like when patients want to access their own medical information, they can just go online using a secure website and using the password and be able to access their information that way. When it comes to implementing electronic health records, of course, we have to think about the financial aspects regarding this. Like I was saying before, in regards to the acts, there are incentives that are offered to healthcare providers who incorporate the EHRs. You also have to think about the expense it takes when it comes to training the physicians, the nurses, CNAs, therapists, that everyone that's going to be involved in taking care of the patient. You have to think about how much it's going to cost when it comes to training them. You also have to think about the cost of the software and of the equipment. But as of March 2014, there has been $22.9 billion paid out to the different facilities across the world that have incorporated EHRs. Overall, $188,951 have been saved in a 4-year period for transcription costs. Even though there have been many improvements in technology, especially when it comes to the medical field, there is room for more improvements. For example, informatics are looking for a way to make the narration when it comes to a hospital stay or a patient's hospital stay more comprehensive. They're looking to make their medical detail more complete and in-depth for the physician so that they're better able to diagnose and take care of their patients. They're also looking to implement photographic documentation. This is especially important when it comes to wounds, when it comes to staging the different wounds and the treatments and making for sure that the treatments that are implemented actually works. As of early 2018, 90% of office-based physicians have used EHRs. And that is the end, and these are my references. Thank you. Have a nice day.